The tribal hostel crisis is a data governance failure, not just a policy problem. The invisible system failure behind the headlines. Rahul Gandhi's recent statement condemning rules at tribal hostels, undermining dignity, masks a more structural problem. India's tribal student welfare apparatus, involving 1.2 million children across 4,000 hostels, with an annual budget exceeding 18,000 crores, US dollars 2.15 billion, operates without a centralized real-time mortality registry or health outcome dashboard. The Congress leaders' probe demand into deaths in Madhya Pradesh and Maharashtra is politically predictable. What's analytically surprising is that when deaths do surface, often through media investigation rather than administrative detection, it typically means the state-level systems failed to flag them first. This isn't corruption, it's institutional blindness, and that blindness is expensive. The accountability gap. What data actually exists? Start with what we know. The deaths in Madhya Pradesh and Maharashtra were reported to the media, then escalated politically. But no national database appears to aggregate tribal hostel mortality data across states. Each state, AICTE-affiliated state welfare boards, tribal affairs departments, runs separate systems. Some report quarterly, others report annually. A few report only when incidents become public. Compare this to any functioning institutional system. Hospitals report to NCRB, National Crime Records Bureau. Schools file enrollment data to DISE, District Information System for Education. Universities submit placement stats to UGC, yet tribal hostels, serving India's most vulnerable student population, lack equivalent transparent tracking. The Maharashtra Education Department can likely tell you how many tribal hostel students enrolled in 2025 to 26, probably cannot tell you in real time how many are malnourished, how many have missed doses of routine immunizations, or how many have reported cases of sexual harassment to hostel authorities. These are inputs to the dignity framework Gandhi references, but they're invisible to both state and central oversight bodies. The budget to outcome disconnect. Here's where the scale becomes stark. India allocates roughly 18,000 crores annually across Eklavya Model Residential Schools, EMRS, funded by Tribal Affairs Ministry, 4,000 plus crores, state-run tribal hostels and ashram shales, 10,000 plus crores, NGO-run facilities receiving grants, 2,000 plus crores, miscellaneous welfare schemes, 2,000 plus crores. For comparison, India's National Health Mission budget, covering 1.4 billion people, is roughly 40,000 crores annually. A system serving 1.2 million children receives 45% of the per capita health spend, yet lacks the outcome tracking infrastructure. A 2024 CAG audit, Comptroller and Auditor General, India's official performance watchdog, flagged inadequate monitoring mechanisms in tribal welfare schemes, but did not publish disaggregated state-level findings. This suggests the audit itself revealed data gaps, but lacked the cross-state repository to analyze them systematically. The report existed, the transparency machinery did not. The dignity question reframed. Gandhi's invocation of dignity is emotionally resonant, but institutionally vague. What would dignity metrics actually look like? Nutritional adequacy. Tribal hostels should maintain biometric records, height, weight, hemoglobin. Currently ad hoc, a centralized dashboard would flag underweight students within weeks, not years. Healthcare access, routine vaccinations, reproductive health counseling, mental health screening. Most hostels lack on-site clinics. Travel to district hospitals is ad hoc. A unified telemedicine backend. India has 450 million plus smartphone users, could enable preventive care at scale. Safety and complaints, sexual harassment, physical abuse, hazardous working conditions. Many hostels require unpaid domestic labor. Complaints are logged on paper, if at all. A digital grievance system with mandatory response SLAs would create accountability pressure. Educational progression, dropout rates, exam performance, employment outcomes, these vary wildly by state.